This presentation is about an initiative that put together a group of academic and humanitarian professionals. It had the scope to build awareness on the fact that the effects of the war in Gaza on water and health can be foreseen. I will quickly tell you the key moments of this story, and then I will try to extract some lessons. I warn you, I have more questions than answers, but let's go the different steps. Originally, we hoped that by mid-January, we could project the number of people affected by waterborne diseases, and that it would be relevant to the internal ongoing ICRC programming discussions, and in general, raise awareness of the extent of the suffering. And indeed, preliminary results were very quickly produced. However, unfortunately, they were refuted by the internal peer review mechanism that was put in place. Then discussion about a different modeling approach started, and we will see where it led. But in parallel, despite the challenges on the figure, these preliminary results were shared in ICRC. After all, the goal was to raise awareness. And the reaction was, I would say, lukewarm, to say the least. These initial figures appear off scale, and two parties immediately form. The math phobic would refuse because this was all too complicated. And on the other hand, math supporter would appear too enthusiastic to endorse them. Communication was overall very challenging. There was a challenge to understand probability, a challenge to understand the multiple levels of uncertainty, especially in relation to the distinction between direct deaths and the indirect one that were and still are invisible. But in the meantime, in February, a parallel, not known to the group initiative from the London School of Hygiene and Tropical Medicine and Johns Hopkins shake the foundation of this initiative. They published a study that was doing exactly what we hoped to do. So now we were already struggling, and inside the group, question raised were, okay, how do we relate to this study? Shall we try to confirm it? Shall we try to go deeper? So after almost 2 months from the first iteration, a new model was released. It was fancier, with more detail, but as one of the contributors said, it was not more nuanced. Assumptions behind it were still considered too fragile, so ultimately it wasn't validated by the internal reviewing mechanism. So here we are at the end of the story. A report was published in mid-April, and it emphasizes how reverberating effects can be foreseen and evaluate them in the lens of international humanitarian law. I personally do believe that is a great piece of work. It is perfectly aligned with the previous work of this group, but it does not contain any quantitative figures. And it is undeniable that this has left sort of a bittersweet feeling among the members of this group, of these initiatives. So if this is the story, I would like now to take a couple of steps back and trying to look at this experience from a learning perspective. So, as mentioned, the initial scope of this initiative was to find a balance between time, advocacy, purpose, and a scientific soundness. The initial steps, indeed, were performed in an extremely time-sensitive way. Advocacy was felt meaningful only if results were out fast, very fast, and only 2 weeks between the conception and the first results occurred. Peer review in itself was not questioned. On the contrary, it was considered cherry on the cake. The tacit assumption was that it will amplify the message and its credibility and make it even more useful for advocacy. But when the cold shower of the first round of the review arrived, things really changed. Very quickly, academic professional standards took over from other considerations. Scientists doubled down being more rigorous. They added more math, more effort in demonstrating assumptions. And the challenge itself proved to be a very difficult one to crack. It was realized that this has never been done before. There is no precedent in the literature of modeling an open conflict. At least 11 different modeling approaches were suggested, were mentioned. So in this situation, even the management of quality control become an issue, a variable, if you want. Somebody suggested that perhaps peer reviewer should be incorporated earlier in the process, but then you would argue it still is a review. And even the study from the London School had a say on this. Apparently, it wasn't peer reviewed. So the assumption that we imagine is that they consider that the names signing it and the institution behind having enough credibility to push it, but as well on the methodological side, they have been creative and they propose a very interesting mechanism to extract to cover the gap in data with an uncertainty-aware expert elicitation model. So, if we continue in this path, what about a reflection on academic competition versus collaboration? Competition normally is an healthy driver, but in a situation like this, where there are high humanitarian stakes and huge time pressure, perhaps there is room for improvement. Perhaps a mechanism of pulling together information about initiative having a potential impact on ongoing humanitarian crisis could be envisioned. On the communication and the sharing of the results, huge challenge appear. Basically, they can be boiled down to one single question. Would unintuitive results be trusted? So I think this is really the key question. If something wasn't expected, this lack of perceived lack of data and the expectation that generate would corroborate results that are not what are expected. And finally, there is as well a consideration related to the role attributed to quantitative figures in decision making. Why it is so important? Is it perhaps that quantitative evidence reduce the burden of risk taking in identifying humanitarian response? And I'm talking about programming risk, not security risk. And I wonder if that should be, and to what extent. Perhaps we don't have the time now to discuss very much, but for me, this relates very closely to the role of WASH activities as life-saving activities. There has been plenty of discussion, and here I'm quoting some of the reports that, to me, tackle this point. But I want to finalize this work, attempting to close what we call the triple learning loop, so assessing the assumptions that led to the way this initiative was shaped. Possibly some of them look pretty trivial or untouchable, but perhaps there is a couple of them that might deserve attention. The first one already mentioned, but maybe removing competition and enforcing collaboration when there are urgent humanitarian stakes might be a good idea. And I think that what WHO did during COVID, when they create a central repository of research, might be an example of how it could look like and demonstrate that it's possible. And on a second hand, I think that once again, not new, but it's important to focus on communicating and handling complexity. Maybe focusing more on the connection, on the pathways to a crisis rather than the numbers corroborating them. So finally, I use this as a final slide. It's the latest dashboard from the health cluster. One thing that is certain is that these data are considered severely underestimated. I just want to share a big appreciation to the group of people behind this work. It has been really amazing, and I really appreciate that they accepted to share publicly this experience. I hope I made justice to their commitment and their professionalism. Thank you for listening.